morning, everybody, and welcome to this meeting of our local outbreak and engagement board. This will be a virtual meeting with a remote attendance by councillors and remote access of press and public, and will be held in accordance with the provisions of the local authorities and police and crime panels, coronavirus, flexibility of local authority and police and crime panel meetings, England and Wales, regulations 2020. I'd like to welcome everybody to this meeting, and first of all, our first item, any declarations of interest, please? No, thank you. The second item on our agenda are the minutes of the previous meeting. Does anybody have any comments to make about the previous minutes, please? So I'll take it that those minutes are adopted. Thank you. Our third item on the agenda is our local outbreak and evacuation plan in the hands of Senior Manager Nicola, please.
Thank you, Chairman. So I think the focus since the last meeting has been very much on the opening up of the businesses on the island, and welcome back to visitors that we sorely need to help our economy. So there's been a lot of focus around the opening up and safe opening up to make sure that both our businesses and our visitors are safe when they come to the island. So we've been working very closely with the police, and our thanks go to the police for some joint meetings and visits between environmental health and police to ensure that businesses receive the support and guidance that they need to open up safely, and that's included things as diverse as how to set up gazebos and marquees safely, as well as making sure everyone's got the right QR codes to make sure that visitors are recording entrance into hospitality venues. The big news, I suppose, has been around further business support grants that have been awarded to us. We've had restart grants, which have amounted to 2.3 million over the last month, that's since April. Payments have been paid based on rateable value to businesses, and there's no application process there. Those will be administered and provided to businesses directly. The discretionary grant, what's called the additional restrictions grant, has also been, a further round's been awarded, and we've got £35,000 for that, and we've opened up expression of interest for those businesses in particular who've not had support, and the criteria for supporting businesses has been broadened out in this latest round, third round of grant funding. So our application process is open now for businesses to apply. You know, wholesalers are now eligible, brewers, freelance and mobile businesses, hair and beauty providers, etc. So we're encouraging people to apply for support if they need it through the additional restrictions grant, and that application process is open until the 25th of April. And the process itself, the application forms are on the council website. I think the other things that have been sort of foremost in our minds over the last few weeks have been around the community testing. And Abby Wrigley's on the call and will give us a brief update on the testing facility. But we've been using the town hall's now been set up as a community testing centre, and that will be operating until the end of June. I think the other thing that's become more apparent is the need for a collection point for people and businesses to collect lateral flow tests. And if it's okay with you, Chairman, I think it might be appropriate for Abby to give us a brief update on where she is with the lateral flow testing and the community testing facility.
Yes, thank you very much, Nicola. Abby, would you like to come in then, please? Thank you.
Hello, thanks. Yeah, so PCR testing continues as it has done now since last spring, and those tests continue to be sent away for anybody who's symptomatic or pre-procedure and any other referrals. But as Senior Manager Nicola mentioned, community testing has been our focus recently. So the Town Hall is now our community testing centre. That's operational, and for those that would like that support. We also now have a stock of home testing lateral flow kits available, and we are issuing those to the eligibility keeps widening, but we're issuing those to eligible people with support and guidance as to how to use them, and also with follow-up as to how to access a PCR test if one of those tests were to test positive. And we will continue to support the community by offering those tests and talking to businesses proactively about whether they'd like to be involved in that. If anybody's got any questions on that, I'm happy to answer.
Thank you very much, Abby. Whitney, would you like to come in, please?
Thank you, Chair. It's not a question, Abby, but just to support you in that the wider use of lateral flow testing is really great. We're really happy to welcome it to the islands. But just a reminder, you always hear me banging on about these things, that lateral flow tests are about 50% good at telling you whether you've got it or not. So even if you get a negative result, half the time you could still have coronavirus. So it's really important that we don't relax our prevention measures. We've got to use those tests and use them regularly, but just a little reminder there. And if you get a positive lateral flow, immediately self-isolate and order a PCR. Because what we're seeing with really, really low levels of COVID that we've got at the moment is that sometimes you might get a false positive in a lateral flow. So we do that confirmation PCR test just to be sure. And that's across the board everywhere. We'll be doing that. And on the islands, we've been doing it anyway. So it's really, really good. Just to support the testing agenda as well, just to mention that we are gearing up for possible surge testing at any moment. So Abby is heavily involved in the surge testing plans. So that, to be clear about surge testing, is if a variant of concern is found in a positive test on the Isles of Scilly, it's up to DHSC, on the Secretary of State. It sits with Matt Hancock for that decision to tell us whether we need to do surge testing, and basically that's just mass testing. And for the first time possibly ever, it's a bit simpler on Isles of Scilly because we already have a really comprehensive outbreak plan, and it's very, very similar to what we would do in a surge test scenario. So much easier for us than it would be in the mainland, for example. So just to say that our testing colleagues are really heavily involved with that and working with us both on a regional level and a national level with this plan.
Thank you very much for that. Do we have any other questions, please, for Nicola or Abby? No? Well, thank you very much indeed, both for your update. And we'll move on to you again, Whitney, please. Item 4 on our agenda, which is the update from the Director of Public Health. I know Rachel is unable to be with us today and sends her apologies, but thank you very much for joining us on her behalf, and over to you. Thank you.
Thank you, Chair, and thanks for having me this morning. It's really good news in terms of cases, both locally and across the country at the moment. So for Cornwall and the Isles of Scilly, we get lumped together. We're at 10.1 cases per 100,000, so that's as low as we've seen it for quite some time, probably since last summer. So that's great. You will see from now on just sort of up and down, sort of undulating numbers as we go through, because it's such low numbers that if you get anywhere, it affects the total. So just have that in the back of your head. If we're going to see any fallout from people possibly mixing over Easter and school holidays, it will probably be by the end of next week if we catch any extra cases. And as we all know, we have the wider opening from yesterday. You'll have lots more visitors, lots more people from outside Isles of Scilly, possibly mixing and coming to the islands, which is great news, but we're reminding everybody to still be very careful and cautious as we move through the wider opening. To add to the testing as well, can I just ask everyone to remember that there is the COVID-19 app as well. So if you do end up with a positive test, lateral flow or PCR, you can add that to your app and let the app know, and it will let close contacts know as well. There's been lots of updates to this app. I know we've kind of been negative about it previously, but there have been many updates, and I would encourage you, if you haven't already downloaded it, to download it and start to use it as we move into this busier period. I would encourage everyone to take up the offer of lateral flow tests, particularly in our hospitality areas, because you are kind of the front line, aren't you, once we get into tourist season, of people coming from all over the world and the country. and mixing with you. So our hospitality colleagues, I would really encourage you to take up the offer of lateral flow tests regularly. A one-off lateral flow test isn't helpful, but doing it twice a week is really helpful. So please keep that in mind. Update on vaccines. I can't extrapolate that data just for Isles of Scilly, but it's a fantastic update across the board. We have really, really high uptake, over 90% or 98% for the over 80s, and that continues right the way through to the 50 pluses in terms of very high uptake. I would say that if you have decided personally to not have your vaccine previously, but you think you want it now, it is an evergreen offer. The offer never expires. You can always get that jab. So just keep that in mind if you were a bit hesitant before and you've changed your mind. Likewise, if you're still a bit hesitant and you want more information, please make sure you get that information from the NHS or the World Health Organization, or speak to your healthcare provider about your particular needs. It's really, really important that we keep this vaccination program going. And I think that's all I have. Sorry for quite a lot of words very, very quickly, but I'm happy to take questions.
Thank you very much, Whitney. Does anyone have any questions for Whitney? No? Well, thank you very much indeed for your update, Whitney. And I would just like to say from the chair to those people listening to this meeting, I'd very much like to endorse what you've been saying, Whitney, about us keeping vigilant, keeping safe, making sure that those around us and everybody do not relax their guard, even though we're hopefully moving out of these periods of restriction, we still must maintain our safe working practices as we have been doing and have been keeping the island safe. Let's not fall down now. So please make sure all of you spread the word as much as you can that we should still be keeping safe. So thank you very much. And I'd like to move on now, please, to item 5 on our agenda, which is the communications update in the hands of Tom Walton. Thank you, Tom.
Thank you, Chairman. Good morning, everyone. So the big news this week is the continued phased approach to reopening, which is obviously really welcoming, but it can occasionally result in some confusion, particularly over things like rules on socialisation with the pubs being open, etc. That was something we identified in particular last week as a pressure on the islands in particular, and particularly around the understanding of the rule of 6 and how socialisation can work, how we avoid groups combining and that kind of thing. The rule's very much still in place, the rule of 6, and it's likely to be in place for a few weeks. So we put together an explainer for the public on that with the Director of Public Health to just really get across that we need to stick to that element of the rules to stop that sort of community spread over the next few weeks. The other main comms issue right now is the watching brief. Services have just reopened, the Salonians come in, so we've had sort of 200 passengers coming in yesterday, and it's keeping an eye on those issues and responding as need be. So, we're expected to have to do comms, as Whitney said, over the coming weeks in response to those issues that are coming up, things fluctuating. But as of right now, it's about continuing to communicate this rollout, so nothing further from me just now.
Okay, Tom, thank you very much indeed. Are there any questions, please? Stephen Taylor, thank you.
Yes, thanks for that, Chairman, and thanks, Tom. Just want to check whether or not, because we've got a new influx of people, whether we need to recirculate or re-advertise or republicise, whatever word you want to use, the evacuation plan if somebody does get COVID, so that the owners of the self-catering premises know what to do.
So the evacuation scheme is a backup plan. It's one of the backups that are in place from the council should there be a particular pressure for particular guests if they develop COVID whilst on the island. It's not something that we promote as a sort of feature. It isn't it isn't part of having a holiday. It's not necessarily a thing that would definitely happen. If you were to develop COVID on the island, each case would be assessed on an individual basis by public health. Guest house owners are aware of the situation. It is published on our website what we can publish with respect to the evacuation scheme. But I don't know if you want to come in here, Whitney. It really is on a case-by-case basis, and it wouldn't always necessarily be the safest thing to evacuate someone. So that's why we don't publicise it more widely.
Thank you, Whitney.
Thank you, Chair, and thank you, Tom. Yes, so I think it is on the website, and I know that accommodation providers are aware. I think what I'd like to stress is that the absolute most important part of this is to let the alert know through Keep Silly Safe or ringing us to let us know that you've got a possible case. And then if we end up with a positive case, then we jump to action. And part of that is to consider whether we evacuate someone or not. If we can do it, and we can do it safely and quickly, we'll do it, because there's no reason to keep someone there and put risk to others. And it depends also on how long they have left on their stay. But it's not an absolute given, because there are instances where it wouldn't be safe. So I just want to caution that. But it is absolutely a consideration if we get positive cases, as we risk assess each case individually. Does that make sense? Sorry, Stephen. It's a bit wishy-washy because I can't say for definite, because it depends on the situation for each issue.
It makes eminent sense through you, Chairman. My only point was to make sure that people know what to do if a case arises. We may have new owners, and they may not have been around since last year, or they may have forgotten, or they may have not got a phone number or whatever. So it was just a case of whether or not we need to refresh anything, that's all. Just a question.
Okay, thank you very much. Tom, did you want to come back on that?
Yeah, just quickly. The key thing is, if someone develops COVID, it's exactly the same no matter what we have in place as a fallback. So it really is to self-isolate immediately, request a test via the number which we advertise, and then once you're engaged locally with our local team, that's when they will sort of decide what is the best course of action thereafter. So the main thing to promote in terms of new businesses, if there are any on the islands, is just to say it's still that. It's still isolate, get on that phone number, and then we sort of take it from there, which, as Whitney said, might involve evacuation, but we deal with everything on a case-by-case basis.
Okay. Thank you very much. Councillor Grottick, please.
Thank you, Chair. Question for Tom, really. And I don't know if we've got Dale with us this morning, but I was wondering if we were liaising, I'm sure we are, with the harbour authorities and considering signage on the quay, because I understood from a passenger on the boat yesterday via a friend that there were the obvious large crowds on the quay at Penzance waiting to get on the boat, and obviously that the same number of people will be disembarking on St Mary's, and I think that is going to be a key area. And also, I would like to think that people did keep their masks on after they disembarked and carried onto the narrow streets of Hewtown. And really, it's just a question of emphasising yet again, as I know Councillor Legg has done in the past, that we are vulnerable, and you don't come on Scilly to get away from the pressures and the responsibilities that belong to us all while COVID is still out there in the community. Thank you.
Thank you very much. Tom, do you want to come back on that?
Yeah, I can certainly follow up with the steamship company and with Dale on the harbour just to ask, what they have in place in terms of advertising and on the TV screen, etc., on the Sloanian. So I'll follow up those offline.
Thank you. Thank you very much. Councillor Legg?
Yes, just some feedback on a message that went out that didn't include the evacuation order, the evacuation plan. Lots of accommodation providers were a bit confused by the lack of mention of the evacuation plan and were worried that it didn't exist anymore. So I would agree with Stephen that it would be useful to mention it again and just be clear that it is effectively an option of last resort. I explained to people that it was always the case that it would be taken on a case-by-case basis and there would be a risk assessment for every case. But people are worried that it isn't still in effect. So just some reassurance, and ultimately the purpose of the evacuation plan has always been providing that reassurance to the economy that we will do everything we can to help.
Okay, thank you. Are you happy to take that forward, Tom?
Yeah, we can certainly reiterate what we would like people to do in the, on the occasion that someone did develop COVID. And once again, we will mention the evacuation page. There is a page dedicated to it on the website, so if anyone is unsure, they can definitely pick that up. But again, if we were to do that, we would still major on self-isolate, phone the phone number, and continue. But yeah, we can absolutely mention the fact that this is one of the things that will be considered should anyone develop COVID.
Thank you very much. Councillor Grottick?
Thank you, Chair. Can I quickly clarify? When I said that we can't be complacent and we should act here because COVID is in the community, I meant the wider UK community. So far as we know, we're luckily COVID-free at the moment, but we must all obviously consider that might not be the case if we let our guard down. Thank you.
Thank you very much. Any other questions, please? No. Thank you very much then, Tom, for your update. Item 6 on our agenda is any other business. Has anybody got any other issues or business they'd like to discuss at this meeting, please? No? Well, thank you very much indeed. I'd just like to reiterate what I mentioned earlier, that although we're lucky enough to be relaxing some of our measures and welcoming our visitors again, we must not relax our guard and make sure that we keep safe. And I would just like to finish by thanking very much Whitney from Public Health who's joined us and for her update and her continued work on our behalf, and to Nicola, Abby, and everybody else involved in keeping us safe. Thank you very much indeed for your support of our community. With that, I will close the meeting. Thank you very much indeed.
Thank you.
Thank you.